Good morning. My name is Erin Meyer, and I will be reviewing securing and resecuring the neonatal endotracheal tube using the 3M multi-pore tape. ET tube placement. Note the depth of the insertion of the ET tube prior to any manipulation of the tube. The tube depth should be marked at the level of the gum. Please remember that manipulating ET tubes, taping and retaping, is a two-person job, whether it's a therapist and a nurse or two therapists. For the teaching purpose of this video, only one therapist is used for taping to ensure good picture and video quality. To prepare for securing your endotracheal tube, you need to gather a few supplies. These include the 3M multi-pore tape, a pair of scissors, detachal if you are removing existing tape, skin prep using the 3M Cavalon no stain barrier film, and 2x2 gauze, both dry and damp. Cut 2 pieces of tape from your 3M multi-pore roll of tape. The length of this tape should be measured from the tragus of the right ear to the tragus of the left ear. These 2 pieces of tape will then be trimmed into what is known as the X piece and the I piece. They are shown here on the slide. Prepare the baby's skin for the application of the tape. Prior to application of the no stain barrier, make sure the baby's skin is clean and dry. Then apply your no stain barrier to both cheeks of the baby and along the upper lip. You are now prepared to apply the X portion of the tape to the baby's skin. Center the X with the nasal septum if possible. Place 1/2 of the tape across the upper lip and onto the cheeks, leaving tabs on either end for ease in removal at a later time. You will now secure the 2 free pieces of the X tape to the ET tube. Ensuring that the ET tube has not moved in or out, begin with 1/2 of the X that is free, wrapping it up the tube in a candy cane fashion, leaving a small tab at the end. The last half now wrap in the opposite direction up the tube, again in a candy cane fashion, leaving a tab at the end. Gently squeeze the tape to the ET tube to ensure it is properly attached. You will now apply the eye tape. Starting on one side of the baby's face, move the tape up the cheek, across the upper lip, loop it around the ET tube 1 time, and then down on the opposite cheek. Gently smooth the tape into the baby's face and squeeze the tape up the length of the ET tube. The ET tube is now secure. Now make note again of your mark and document appropriately. In our neonatal population, oftentimes the ET tube needs to be repositioned, or for other reasons, the tape needs to be replaced. When this happens, using detachal to remove the tape will allow successful removal of the tape without dislodging the tube. Apply your detachal to both the tape that is attached to the baby's face, along with the tape that is attached to the ET tube. This will ease in the removal of the tape and prevent skin breakdown with the removal of the tape. I hope you found this presentation helpful when using the 3M multi-pore tape for securing and resecuring the neonatal endotracheal tube.